Good afternoon, everyone. My name is Desmond Banks. I'm a clinical teaching professor here at the Boise State University School of Public and Population Health, and I am delighted to have you here today. We've got an amazing presentation here today. It's going to be led by, in part, our very own Dr. Jacoba Rock, who is a clinical associate professor of social work here at Boise State University. She's also an affiliate faculty within our School of Public and Population Health. Joining Dr. Rock today, we also have Dr. Charles H. Lee III. He's an assistant professor of social work at Columbia University and also a faculty affiliate of the Columbia Population Research Center. They're going to talk to us today on the de-implementation science and its impact on social and public programs. Our speakers have asked you today to, this is going to be an interactive conversation. So if you have any questions, you don't have to save them to the end. Just go ahead and put them right there within the chat box there, and we'll try to answer those in real time as possible. We may not be able to get to anything, but please, throughout the presentation, just go ahead and put your questions within the chat box, and our presenters will be sure to address them. All right. Thank you. And without further ado, over to our presenters.
Thank you so much, Desmond, for the warm welcome and for inviting us to offer this workshop, especially a workshop that's available to everyone for free. I'm excited about it. Thanks to Haley for coordinating. That's appreciated as well and helping us to just navigate this Zoom session. And thanks to the School of Public and Population Health for having me as an affiliate. I'm really excited to join the school and have the support of all of my new colleagues. So I'm going to go ahead and share my screen, and I just ask for a thumbs up from anyone that I can see that they can also see the screen. So actually, hold on, let me make sure. This worked a moment ago, so it should work again, right? That's how that works. Charles, can folks see it? Can you see it?
We can see. We're good. We're good to go.
Wonderful. Okay, wonderful. So, again, welcome. Thanks for being here. The title of our talk today, and really, again, we'd like to make it interactive, so please use the chat box to share your reactions and questions. The title of our talk is De-implementation Science, Opportunities and Obligations to De-implement Ineffective, Inefficient, and Harmful Programs, Practices, and Policies in Public and Social Services. Both myself and my wonderful collaborator, Charles, are going to start by just sharing some things about ourselves that we find particularly relevant to the work that we're going to be sharing with you about. We'll end the presentation by also sharing our contact information. Part of our purpose here is to simply spark conversation, and so we want the conversation to keep going. So we'll offer our contact information at the end and also encourage folks to connect with each other about the subjects that we share today. So an overview of what we'll provide after introducing ourselves: we will be examining public and social services in the U.S. context, and my assumption is that many of you have personal and or professional experience of some of these systems, and we're going to ask you to think about those as we go through our workshop and think about how the concepts that we introduce will apply. We'll define some of those concepts. We're going to be offering some models in de-implementation science for discussion and for comparison, and we have an article that Charles will put in the chat box, a link to. It's an open access article that you can read to look at these models more closely than what an hour will allow us to do today. We're also going to be sharing with you some potential programs, practices, and policies that we would consider for de-implementation. Charles and I will do that in the context of criminal and juvenile justice, which is one of our own areas of focus in our practice and research. But we'll invite you to do that in your own areas. For example, if you're in child welfare or public health care work, or if you're in education or in aging services, we'll ask you to consider how these concepts apply elsewhere, so you don't need to be focused on criminal and juvenile justice throughout. These concepts should apply elsewhere. We'll also be critically analyzing de-implementation within these sectors together and individually. We'll reflect on de-implementation as it pertains to our own personal work, whether we're in practice or in research or even education. And we'll also discuss our next steps together. And again, we are trying to spark conversation and next steps. We're trying to spark some action as a result of our talk. And so we're hoping that you can identify what you might do with this information at the end. So I'll start just by sharing a little bit about myself and then invite Charles to do the same. It's really important in our field, we both are social workers, to reflect on our own identities and how they play a role in our work. So I'll start by sharing that I identify as a pracademic. If you're not familiar with that term, it's a combination of someone who's in practice and in academia spaces, and that includes for me applied research. So I see it as my job not only to do the work with the populations I serve, which are primarily in juvenile and criminal justice spaces, but also my students. And some of you are my former doc students, and I'm really excited to see you here. But also to try to change those systems using information I know from what I've learned and through the research that I do, which is quite applied. But that's not the only way I'm connected to this subject. I was raised with an incarcerated family member and grew up seeing the many ways that systems work and don't work for the people who are in them. And now I adopted two daughters, and one of them is now incarcerated as well. And so throughout my own path, I've seen ways that systems do not always help people or even could cause harm. And that's one of the ways that I come to this work. I was also a caregiver for a parent for many years and found the healthcare system to be especially hard to navigate, even as an equipped social worker. And so I've been questioning some of these social service systems my whole life, and I can't not do that in this work. I also want to just reflect on my own privilege, the power that I have over the communities that I work with and the communities that are affected by this work, and the ways in which I try to wield my power into doing good in those spaces. And that includes in academic spaces where we've sometimes only been encouraged or funded to build a new shiny thing, which Charles and I will talk about, or a new program, or and that's not always what communities need. Sometimes they need us to do less. In fact, sometimes we're causing harm despite our do-goodness or good intentions. So I've learned a lot about that in my own path, and that affects how I come to this work as well. So I'll hand it over to Charles to share a little bit about what this looks like for him.
Great. Thanks, Jacoba. Can you all hear me? Okay.
Yes, sir.
And good afternoon, everyone, and thank you all for being here. My name is Charles Lee, and for me, I come to de-implementation not just as a scholar or a facilitator, but as Jacoba, someone who's been both personally and has personal and professional experience that has been shaped by proximity to both public and social service systems, that cause real harm, particularly, mass incarceration, carceral systems. And so in my life, I've seen how people, particularly, Black and racially minoritized communities, are often subjected to various programs, policies, or practices that, are clearly ineffective and efficient, but also just damaging. Yet, I'm thinking of the DARE program, for instance, that I also participated in as a child in elementary school. But as we all know, many of these programs, like the DARE program, remain, firmly in place because, they're often familiar, politically protected, or just institutionally convenient for most folks. In my professional work as a qualitative researcher, I spend a lot of time listening to people who are navigating criminal, legal, educational, as well as different social service systems. And these are people who are often labeled, surveilled, and also managed, rather than supported in different ways. And over in these experiences, I've been struck, by how harm has been normalized in these systems and how rarely we often ask the question of whether a program or policy should exist at all. And so de-implementation for me, really gave me the language and the structure for something that, was already wrestling with myself. And, really just the reality of just improving harmful systems, is not just the same as creating justice. And so for me, this is where abolitionist thinking, became really critical and has really helped me to understand, justice not as reforming systems, that were never designed to serve anyone, but actively reducing their reach and reimagining what care, safety, and accountability could look like if they were led by communities themselves. And so from this perspective, the implementation for me is really not about just taking something away or leaving nothing behind. It's really about how do we interrupt harm, and also make room for something better. Um, so I also want to name, that I hold institutional power as well as an academic facilitator. I don't know what happened to your screen, Jacoba. But that shapes how, I often show up in spaces and, what responsibilities I carry. And so for me, this means being accountable, staying grounded in lived experience and resisting, this pull to turn the implementation to something that's purely technical or neutral in its exercise. And so justice for me is really required that we remain honest about who's harmed, who benefits, but also who decides what stays and what goes. Uh, Next slide. I don't know what's going. The slide is going in and out.
I think that's my fault. Is it, can you see it now?
Mm-hmm.
Okay.
Yes,
All
ma'am.
right. I'm going to stick with what I'm doing and stop touching things. Um, that's hard for me. We also want to recognize the current context that we're in and the calls for some form of defunding for various reasons and with various processes from a variety of perspectives and groups. That there are calls to defund, for example, child welfare, policing systems, ICE currently out of concern for harm. That there's also calls for defunding from an efficiency standpoint and actions that our government has taken to defund because money may or may not be used efficiently. And so while we won't do any of these sort of cost benefit analyses explicitly today, we'll ask you to think about this context and sort of what influences you when you think about removal of services and why this may be an important time, an especially important time in social services, and also in higher education when there's concerns about budgets, for example, and calls to do less. How do we decide to do less? Is it evidence that's driving our decisions? Is it ethics that are driving our decisions? What perspectives, personal beliefs, and professional ideas do we bring to the decision to potentially defund or stop participating in certain practices or systems? I also want to connect this to some common concepts in social work. I often am responsible for teaching students about the difference between equality and equity. I really like this image to help folks understand that those are two different ways of providing resources. Both could be very well intended to help people. When we take an equality approach, what we're doing is providing the same resources to everyone. So that may mean that those who don't need those resources still get those resources. That's an efficiency issue. It may also mean that if everybody's getting the same resources, that even those who are receiving those resources are not getting as much resources as they need. That's also an efficiency issue, and it also causes harm and is ineffective. Not everybody's able to see over the fence, right, on the left side. And by the way, I never thought of myself as someone who would use a sports analogy in a presentation because I don't know sports and I try to giggle and smile along to those conversations, but I don't know what's going on. However, I can understand and use this image. From an equity standpoint, we provide different resources to everyone with hopes of the same outcome, right? Everybody being able to watch the game, or in my case, just pretend to watch the game. So we're looking at how do we use resources differently in this scenario. Many would argue that our current reality provides a lot of resources to those who don't necessarily need them and doesn't provide any resources or even takes away from what someone's ability to access an outcome is. But true liberation goes beyond equity, and it involves removing barriers. And to us, this aligns with our de-implementation ideas around just simply removing what might be causing harm in the first place. And in this case, we recognize it may actually sometimes be some of our programs, practices, and policies that are actually causing the harm, and we may need to remove them. So we're going to be sharing about that specific approach today while recognizing that's not the only approach.
So to just build a little bit on the points that Jacoba was making about our shared obligation being liberation, and not just improvement, then the next question really becomes, a more practical one, and that is like, well, what kinds of changes actually move us towards liberation, and which ones keep people stuck behind the fence? And so this is where the distinction between reformist and non-reformist reforms become useful. Reformist reforms really focus on improving how systems function. And in this case, they really make systems more efficient, they're better resourced, or more publicly acceptable. Um, but the goal is that they leave the system itself intact. In practice, these reforms make systems, more harmful, make more harmful systems, more durable by essentially stabilizing them and extending their reach. On the other hand, non-reformist or abolitionist reforms start from a different place. They ask how to reduce the system's power, its reach, but also its capacity to cause harm while simultaneously building alternatives that support people's freedom, safety, and well-being. And so de-implementation really sits squarely, in this particular tension, in that it really forces us to move from these abstract commitments to these to concrete decisions. And so when we consider removing a program, policy, or practice, the key question is not whether it changes the system, but whether it reduces the system's grip on people's lives. And that's where liberation becomes the metric. Next slide, please. So in this image, just to give you a graphical depiction of this, it looks at we're helps us see kind of what it looks like in practice when reforms keep people behind the fence, even when they are framed particularly as progress. And so reformist policing reforms, for example, often include things like body cameras, bias training, or civilian review boards, or other new protocols. And so these changes are, usually presented as accountable measures, but they're rarely reduce police contact, surveillance, or punishment. Instead, they often increase public trust in policing and justify, some continued or expanded investment. And from a de-implementation perspective, this is a critical warning sign because, again, these reforms do not remove the harmful practices. They're just layering new ones on top. So the fence in this case remains in place, and sometimes can get even higher or stronger. And in practice, this means that, time, money, and political energy are often spent maintaining systems that communities have long identified as harmful, rather than asking, whether those practices should exist at all. Um, next up, slide.
Charles, it's not letting me click over to the next slide. Can you hear me okay?
Yeah.
I'm going to stop share and then reshare and see if that fixes what our issues seem to be.
Okay. It's not showing for some reason.
There we go. There we go.
Okay.
Can you see it okay?
Yeah. So, just lastly, and alternatively, this image is shows us what it looks like when change efforts are oriented towards people getting from behind the fence, as in the liberation image that Jacoba showed. And so these are non-reformist or abolitionist steps, which focus on reducing the system itself, not perfecting it. And so in practice, this includes eliminating things like in policing, particularly like low-level offenses, reducing police presence in schools and communities, ending police responses to mental health crises, but also redirecting resources toward housing, healthcare, education, community-led safety. And so those aren't symbolic changes. These are become these more material reductions in the system's power. And so de-implementation really aligns with this approach, really by prioritizing the removal of practices that, again, reproduce harm, but by insisting that what is taken away must be accompanied by some investment and alternative. And so in this case, liberation is not really achieved just by absence alone. It really requires building conditions where people do need to be policed or punished or survive. And I think Ruth Wilson Gilmore kind of points to this particular aspect in one of their quotes. And we can move to the next slide.
Think I got my ability to navigate the slides back. That's good news. Our presentation was trying to de-implement me. So we are going to offer a working definition. Working definition, we truly mean that. So if you have suggestions, please offer them. This is not the final definition we're going to offer you, but it's one that's in the literature. We want to mention there's relatively limited literature about de-implementation. Almost all of it comes from healthcare, but it's still really in a conceptual space in a lot of ways, though it has been tested with specific healthcare practices and in very, very limited ways in other areas of social services that we'll share with you. The working definition that comes from Bailey in 2021 is that de-implementation is defined as discontinuing or abandoning practices that are not proven to be effective, are less effective, or less cost effective than an alternative practice or are potentially harmful. The main thing that you'll see Charles and I add to this is about harm. So you're going to see, harm, efficiency, and effectiveness all in the definition that we provide to you. Some background on de-implementation. one thing we want to stress is that it is intentional and that it is structured. So this isn't just a matter of something accidentally or coincidentally going away, but in fact, a decision, and we would argue a decision that's made amongst those who know a lot about the program, practice, or policy, but also those who are affected by it. It's a community involved decision, an intentional decision, and an intentional process. And you'll hear different words used in this presentation like dismantling, abandoning, ending. So you'll hear all kinds of different words, but we are being pretty consistent with the use of the term de-implementation of these programs, practices, or policies. And so we're most interested in those that we have evidence to indicate, and we use evidence as an expansive term that includes lived experience and mixed methods of collecting that evidence, but evidence that indicates that something is ineffective, inefficient, and harmful. Those might be the ones that we say are going to be most prioritized for de-implementation. Again, this has been conceptualized in the healthcare arena, so we're going to show you some models from those healthcare scholars, but the terminology and applications vary quite a bit. Our focus today is mostly on organizations and systems instead of individual workers, meaning an individual social worker, to draw from my own field, can decide to remove a program or a practice from a treatment plan. Let's say in child welfare, they can decide that it's time that a parent doesn't need to attend therapy anymore, or that a visit isn't going to happen anymore. That would be de-implementation, but it would be at an individual level with an individual practitioner. And sometimes workers need to make really important decisions to de-implement. So we don't want to take away from that. But what we're interested in is a more systemic approach to de-implementation that involves organizations and communities and entire systems removing programs, practices, and policies that are ineffective, inefficient, and or harmful. And we have to question why this hasn't already happened, because as Charles has already alluded to, there are certain programs, practices, and policies that we have known for quite a while are not being effective, are not being efficient, or actually having, and I like the term iatrogenic effects, which is used in medical settings sometimes, are actually having consequences for people who are accessing them. And we've had that evidence for some time. So why hasn't this already happened? So we wanted to start with that because we need to remove some of those barriers in order to move forward. The research is limited when it comes to de-implementation, so that could be one reason. We don't always know from an empirical standpoint what this can or should look like, but the emphasis in research has generally been on innovating, specifically through development or adoption or scaling up of practices that already exist. Those also align often with funder values and institutional priorities, as Charles mentioned. Also out in practice, which I can speak as much to, there's sort of a fear of change, right? An attachment that we have to programs, practices, and policies that we like or that we believe work, even if the evidence indicates otherwise. And we might be concerned about removing something that we've already had. I really like this term institutional inertia, right? There's this sort of belief building even around an idea that may or may not be supported by evidence or by people's experience of that practice. There's also accountability pressures and funding streams that we're tied to, sometimes for many years at a time. And there's professional values and beliefs and norms, including in my own area of practice and social work, that are aligned with fixing things, and a belief that we can sort of jump into people's lives as professionals and as experts, and that we are going to fix it through introducing something new. And we have to really de-implement and really debunk within ourselves in order to disrupt some of these patterns, right? In education, we also have outdated models for supporting this work, and there's concerns about limitations on critical thought and doing critical work that's just simply different. Even if it's different in ways that are aligned with our ethics and values and even our funding, if it's different, and that could be a problem. Oops. And then across all of these contexts, there's sort of a centering of privileged experiences and perspectives. So while we recognize that some of these programs, practices, and policies we'll mention have benefited some people, those are usually the people who already experience privilege and whose perspectives are most honored in practice and research, and may not be the people who are most harmed by those practices and programs who have historically had less voice. That includes people of color, people from low socioeconomic statuses, LGBTQ communities who are harmed by practices that all benefit or just don't harm others. So we're going to show you this model comparison. What we did was pull from some existing published literature, again, mostly healthcare focused, and look for similarities across the models that are used to de-implement. And we can zoom into different areas of these stages and think about our own responsibilities, our own next steps within our research or practice. And again, we're encouraging you to use the chat box if you want to share about how you could use this information. We may not address it in real time, but we'll loop back to it, and we appreciate the commentary. So feel free to use the chat box to share reactions or questions even before we get to the end. So most of these models include some period of identifying what in fact may need to be de-implemented. And we would argue that each of these stages should be led by both evidence and ethics. And so using an evidence approach, an evidence-informed approach, we might engage in some sort of assessment process to determine which are the programs, practices, and policies that are causing the most harm or that aren't being effective or efficient, and have that empirically driven identification process. From there, we may identify a number and be involved in some sort of selection process and use criteria, right, evidence-informed criteria, in order to make a decision about which of those methods or practices are most harmful. So an example I have of this is around the use of isolation and administrative segregation in facilities. In recent years, there's been efforts through organizational policies and also legally to put parameters or limitations on the use of isolation in carceral settings. And yet it continues to be in practice, including with young people who are especially harmed through isolation practices. And so using that as an example, if we were engaged in assessment, I know through practice in working with young people who have been isolated about how it harms them. So we may involve professionals who are aware of that and the youth themselves. But I've even had conversations with administrators who I wouldn't have expected to be against the use of isolation, who say it's really costly. And actually, I had a prison superintendent say this to me recently, like, actually people come out of isolation and then even seem more likely to need it again, right? And so we just keep using it and they never seem prepared to move forward and to be out of isolation. And so hearing these things from multiple sources might lead us to believe that this is something we need to prioritize, that while there are a number of practices that could be de-implemented in this setting, maybe this is one that would need to be prioritized. This is just a hypothetical example, but it's got some real basis as well. So from there, we may move forward to some sort of proposal stage where we propose how we're going to de-implement. And what's important here is just the opportunity to highlight that de-implementation may be cheaper than funding a really big new program or model that we want to scale up. And so this may be a key time to try to do de-implementation work because it might not cost money. In fact, it might save money. And so if you happen to be part of an organization that's trying to slash a budget or trying to save costs, this might be a great time for you to be thinking about de-implementation and proposing it. Maybe it's an opportunity to kind of reach across aisles and look at something that everybody could be invested in. So from there, we get to the actual action of de-implementation. And I just want to share the observation that a lot of folks are having conversations around de-implementation, but they don't always involve action. So that's really important, even if it's a staged and gradual process, but to get to that point in which there is action is key. And then we would argue continuing to be evidence-driven throughout this process, which includes evaluating how that de-implementation has gone, monitoring it. Another thing we've observed is that things tend to sort of sneak back, even when there's not evidence to support that they should do that. Isolation is another example of that. Sometimes we rename things like administrative segregation, in order to sort of allow it to kind of wiggle its way back into spaces, but monitoring to make sure that that doesn't happen, and also to see what the impact is. And certainly we know that people may disagree about what needs to be de-implemented, or they may think it's a good idea, and then it could actually cause harm to remove something that the community believes in, or something that people have experienced benefits of. So that monitoring and evaluation process is really important. And then some of these models involve a process in which we're going to reallocate funds, or we're going to move forward in proposing to de-implement something else or some related practice or policy. And we would say this is good, that it's good to be recursive, to learn from our own work, and then to go back and reapply what has worked and not apply what hasn't worked. And so I appreciate that part of many of these models. There's a published paper by Norton in 2021 that looked at a number of factors that should be considered in these conversations, including the strength of the evidence and whether the evidence indicates that this practice is ineffective, whether there's contradictory evidence or mixed evidence, or whether this has simply been untested. And so maybe people believe this practice works, but what we need is truly to research whether this practice works or how it works for people. Also, Norton says that we should consider the magnitude of the problem. What is the amount of harm that's being caused? The prevalence of this problem. How many people is it affecting? Right? The resources that have been involved. We also need to consider what actions should be taken. De-implementation could take the form of reducing where this practice is used or who it's used by, or replacing it, as Charles had mentioned earlier, or simply removing it and not going back to it, or restricting it in some way. We need to consider who should be involved and what barriers may be presented, which Charles is going to share with us a little bit about some of those roadblocks, and also the strategies that should be involved in that de-implementation process.
Okay, so up to this point, we've talked, about what de-implementation is, why systems may resist it, and the conditions that can make it possible. And so the case study here that we present helps us to see, what all of that looks like when it's actually put into practice. And so in this article, Stoll colleagues examined the de-implementation of a point and level behavior management system in youth residential care facilities. And so these systems are commonly used to manage behavior by often tying privileges to compliance. They're also often defended as necessary for safety and order, as we all may even hear in our own research and practice. But, as we've discussed today, they are also deeply rooted in control, surveillance, and punishment, and are inconsistent with trauma responsive, healing centered, and other relational care models. Importantly, this case really reflects many of the barriers we've already named in some cases, in that, there were staff concerns about safety, institutional reliance on just familiar practices, and the assumption that removing a control-based system will lead to chaos in some way. And so rather than ignoring those concerns, the organization, addressed them directly through some planned, intentional, and de-implementational process, as Jacoba outlined in the previous slides. And so at the Village Network, what they call is that it operates across 3 residential campuses. And again, this point and level systems, were fully removed and replaced with these 2 aligned alternatives. The neural sequential model of therapeutics, which reframes behavior through a trauma and brain development lens, and also the collaborative problem solving, which shifts practices from controlling youth to partnering with them. And so this is a key lesson in this article for de-implementation science in many ways, is that, removal alone is insufficient, and that de-implementation really requires reinvestment. In many ways, the study found that, the safety outcomes did not worsen, after the point and level system was removed, which challenged the belief that these punitive behavioral control models is necessary for stability within these types of facilities. This case also really shows how the implementation functions as a non-reformist intervention, and that it really reduced the reliance on this harmful practice. It also disrupted institutionalized punishment and began to redistribute power within the everyday interactions through the collaborative problem-solving program, where they were collaborating with young people. And so in doing this, it really helps to just operationalize just, again, the ethical obligation we've been discussing, where we're moving, from knowing that harm exists to really acting in ways that materially reduce the reach of these harmful systems. Next slide, please. And so again, after seeing what de-implementation can look like in practice, it's also important, as Jacoba was mentioned, to name those roadblocks or barriers that can make this work so difficult. And I often seen some people in the chat commenting on some of these different things as well. And so knowing that these roadblocks can exist even when there's, evidence, when there's readiness, but also some moral clarity about what's to be done within a particular system or intervention. And so one of the most common barriers is this mindset of that's just the way it's always been done. And so this really reflects this institutional memory and professional socialization that prioritizes familiarity over effectiveness. And so in this regard, harm becomes normalized simply just because it's routine. Another roadblock is the pull towards the shiny new thing. And so instead of removing harmful practices, systems may often add new programs on top of old ones. And here the implementation then gets replaced with expansion, and the system grows rather than shrinks. And so that would fall into what we would think of as like more reformist reforms. Relatedly, we see the kitchen sink approach. And here is your folks are trying to fix harm by doing everything at once, without removing anything at all. Um, or the cookie cutter approach, which can, replicate interventions across settings without any attention to the context or community or lived experience at all. There's also the Band-Aid response, and this is essentially just surface level changes that signal action without addressing root causes. I'm thinking of the police cameras, for instance. And so these reforms, can make systems appear responsive in many ways, but they leave the underlying harm untouched. Um, Navigating through troubled waters captures that the reality that de-implementation often occurs amid political pressures, crises, uncertainty, and leaders may want to change but feel constrained by risk, liability, and fear of backlash. And so I saw some comments in the chat related to this as well in terms of our current political context, and definitely something I think we should discuss as a group. And th that brings us really to this question of like, well, who has the keys? And so decisions about what stays and what goes, as we all know, are rarely made by those who are most harmed by these systems. And so power is often concentrated in institutions, rather than communities. And so that prevents a huge roadblock to even getting to the point of thinking about or envisioning what de-implementation might look like. But underlying all of these different roadblocks are racism, classism, and other forms of structural oppression. And so it's good to know that these systems, again, were built in ways that protect power, control resources, but also manage racially minoritized and marginalized communities. And de-implementation itself really threatens that order. And, really that's precisely why it's often resisted in many of the systems that we may often work with or often have to work with as a result of our practice or research. And so it's important to know that naming these roadblocks, really isn't about blaming anyone. It's just about having some clarity as we think about embedding the implementation within our work. And so, but the reminder as well is that if liberation is the goal, we do have to also be honest about, what really stands in the way of us achieving that. And so this brings us to the next slide.
We cannot fix problems we won't name. So here we are. Like we said at the beginning of this talk, our main goal is to spark conversation and to spark critical questioning. And I always think of critical questioning as external, looking outward and questioning others and questioning systems, but also questioning ourselves and our own role in it. And so many of you have asked excellent questions in the chat box related to some of the practices that you are aware of or engaged in, or people affected, or the barriers. And so we're going to just intentionally ask you to think some more about that. So we have over 100 people here, so it would take a long time for us to group you up based on interest areas, and we don't know, most of you are off screen, we don't know about your availability to participate in a group, though we'd encourage you to bring this back to your organization or your network, your peer network of researchers or practitioners. But in the meantime, we're just going to ask you to take a few minutes here to focus on one system or institution, and then even further to focus on some specific programs, practices, and policies that are within that system or institution. So some of you have mentioned some of these ones that we talk a lot about in social work are child welfare, which may also be referred to as family policing, or the family punishment system, child punishment and family punishment. The criminal and juvenile legal systems, what you might hear sometimes is justice, but since not everyone is experiencing that way, sometimes we use criminal or juvenile legal or carceral. Mental health and substance use, health care, and that includes medical and aging care, education, including K through 12 and higher education settings, which I know a lot of you are educators on this call. Housing, those are just some, of course. There are many public and social service systems that you may choose to think about. So we'll ask you to think about one for the purpose of this activity. And then just take a piece of paper, or you're welcome to use the chat box and identify some specific programs, practices, and policies that, from your experience, are that there is existing evidence to your knowledge that indicates that it's either ineffective, inefficient, or harmful, at least to some, or maybe all three, right? So you're welcome to share in the chat box. We encourage it, but if you want to have this be just a personal reflection time, that's fine too. We want you to think about what further evidence would be needed in order to explore or validate the concerns that you have. So what evidence would we need to collect in that sort of assessment and selection process that we talked about earlier? And then through that thinking, we want you to choose one program, practice, or policy that you would focus on, one that you think you would prioritize. So I mentioned isolation, use of isolation in juvenile carceral settings earlier. That would be one that I would choose to focus on, one that I almost unanimously hear from everyone from every side of the aisle doesn't seem to be effective and is even causing harm. I've seen the research that indicates that. I've listened to the kiddos and their families talk about that. So for me, that would be a priority, right? To look at the research around that and to think about the de-implementation process. So then the next question is to think about who needs to be involved. How do they need to be involved? What is the appropriate and ethical way of involving people who are most affected by this program, practice, or policy, as well as broader community members and taxpayers, right? Leaders in this system, practitioners, academics. We hypothesize that if we're not involving everybody in this conversation and in this process in some way or another, that the de-implementation effort is more likely to fail, that it may go back or slide back, like I mentioned earlier. How would you gather the information and garner buy-in from stakeholders in order to de-implement, right? And that includes recognizing that people have different ethics, that we are interdisciplinary in our practice. So I work with a lot of attorneys. I work with a lot of folks who are working in carceral settings, that we may actually agree about what needs to be de-implemented and may even somewhat agree on the how, but we have very different reasons about the why, and that's okay. That's okay from a de-implementation standpoint. But how would we then kind of navigate those conversations? And who is responsible for de-implementing this specific program, practice, or policy that you've chosen? And then finally, what would successful de-implementation look like? Would it look like this thing just doesn't exist? And if so, how does that affect the community? What does that look like for the people who have been affected by this thing? And thinking back just to the roadblocks that Charles shared, what are you seeing? And my guess is you've heard some of these things in your own careers, like why are we doing this? Well, it's just the way we've always done that, right? I have heard that right in my own process quite a bit. So what are the barriers or roadblocks that you're hearing in your own work? So let's just take a couple minutes to do a little bit of reflection. Unless, Charles, do you feel strongly about a group? We only have 15 minutes. No, you don't. Okay, see, I told you. I like to be right. So we don't have enough time for grouping, but we're asking you to just do some individual reflection. So we'll be quiet for a couple of minutes. We'll de-implement ourselves from the conversation and have you think through this. making the assumption that we don't all have it all figured out after just a couple of minutes. But if folks want to start sharing, you can. You're welcome to share in the chat box. You're welcome to unmute if you'd like and share some ideas that you have, some examples of practices. Maybe you only got to the point where you determined what practice it is, or maybe thought about who should be involved in the conversation. But we'd invite you to share for a few minutes in the chat box or by unmuting if you're willing. Thank you, Hannah, for sharing. Hannah's mentioned mandatory reporting. There's a lot of questions and concerns about mandatory reporting and the effects it has, the disproportionate effects, right? So this is one form of evidence that we can seek. Who has de-implemented something, and what has that looked like for them, right? And how would our context maybe be a little different? Thank you, Monica. Monica shared about reproductive health care, bans on abortions, concerns about maternal morbidity and mortality. This your list, Monica, makes me realize that, in a lot of our systems, our lists are long of concerns, right? And so this prioritization process that's in the de-implementation model is really important. Many of you have shared about policies as barriers. So changing the policy or de-implementing the policy in and of itself is the goal, right? Again, we're recognizing we don't have all of the answers here and we're not experts in all these different systems. So we're calling on you to bring this conversation back and just really appreciate you raising these ideas. Yeah, Mona, I see your hand. It's good to see your name. Feel free to
Hi, good
unmute.
afternoon. I had put in the chat earlier about the population I work with it, which is unwed homeless mothers who are also adolescents. And one of the things we're doing is trying to engage fathers because we know there's benefits to fatherhood engagement. And in the process of me creating an explicit and implicit bias training for service providers, we started looking at our documents that we use in my agency and policies and procedures, and just and looking at the paperwork alone and looking for biases. I have to say, first of all, that I'm really appreciative of this training because now it gives me a different lens to look through. But the paperwork alone is the agency uses a 2+1 model, and it almost kind of looks as the father has been an outsider. But when we move into a triangular model, when we look at the mother, the father, and the baby as a whole family unit, it moves to increase engagement with the father. But just looking at the paperwork alone, I'm like, there's so many biases embedded in this, and how do we de-implement these policies and procedures, and even some of this paperwork that we're using when we're doing intake with the new mothers. My agency is fairly new, so I'm really honored that I can do this at the start of the agency in hopes that it will help moving forward. So thank you so much for the invitation.
Thank you, Mona. It's good to hear your voice again and your concern with action. And it's a nice reminder that this isn't all about, for those of us who are involved in like treatment efforts or intervention efforts, this isn't all about the treatment, but also the assessment process. There may be some really simple means through which we can de-implement an assessment, that we may be asking questions or using scales that are causing harm. And we simply may not need to ask those questions or use those scales, or they may need to be replaced, right? But they may not be helping us in our process. We may be intrusive, we may be labeling. That's certainly true in my own world in juvenile justice, where we've historically used scales and testing instruments that haven't been tested with incarcerated juveniles, and we've engaged in a lot of labeling, and the implications have been quite harmful. So simply not using those tools anymore and looking for other tools or other non-tools and ways of gathering information has been important. Thank you. Yeah, wonderful examples in the chat box. Charles, did you want to reflect on anything there? You have
No,
answers, Charles? I invited
I
Charles
don't
because
have
he
any
has
answers. No,
answers.
you've been addressing them as well. I think they're good examples, but I think to Jacoba's point, it's really difficult. And again, which is why we suggest that it should involve multiple individuals or groups or parties in this, because as an individual, it's really difficult to think about the many different ways in which this system, program, policy, whatever might be impacting harm.
Yeah.
But I think these are great examples. I'm like Jacoba, I think about the criminal legal system since that's where a lot of my work is situated. And so things like solitary confinement, it's proven that it causes so much harm, yet there's still facilities that use that. And so similar to the isolation piece that Jacoba mentioned. But
How many
anyone else
names
have
can
any
we?
other questions?
I was gonna say, how many names can we come up for for isolation over time? I think John Oliver has a funny clip about that. Yeah, these are great examples and great questions. And again, part of what we're doing here is to try to foster conversation and to ask you as a next step to take this back to some space that you're in order to engage in this work. So we want to close out by just recognizing the connection here to transformative justice and abolition praxis. Charles and I started this work together a few years ago in different places in our abolition journey, and I know that I have progressed in different ways on that journey, especially seeing some of what's happened in those years and what's happened previously in a different way. But what this does is to allow us an opportunity to reimagine, and that is innovative work, right? So innovation can look quite different when it comes to justice. To combine the ethics that we already have, the evidence that we already have, and equity in our collaborative approaches, right? To do this dismantling work, to take action, to shift power in our communities, and hold accountability to systems that, of course, do use a lot of money and resources and affect a lot of people. To create space through de-implementing for alternative systems of support, and that those are not always or often necessarily needing to be formalized systems or government systems. Those may be ways that communities already carry assets, and that our intervention is not necessary or could even cause unnecessary harm. And in fact, we need to restore power to communities who can and have in the past cared for themselves in better ways than our systems are doing. And also, finally, to align with longer term goals and my own personal bent toward futures thinking and us engaging in futurist practice in order to prepare for what's next on the horizon. And I think these recent years have been a good reminder that it's tough to exactly predict what happened or how harmful some of those events may be, but that we need to be prepared to respond to what's coming up. So again, we just want to thank you for being in this space with us. Ask you to continue the conversation with us, with each other, back in your organizations and in your own networks about how can we move this forward. What are our next steps? Recognizing that it's gradual and that there are a lot of roadblocks in place. How can we build a community that's curious about de-implementing or ready to de-implement, and both are respectable places to be in. And make sure you have access to our article. It is linked in the chat box. And we don't have a formal sign up, but if you email us, we will add you to a list of folks who are working on these issues. Charles and I are forming our own working group around criminal and juvenile legal issues, but we invite you to email us and just stay updated on de-implementation, and we will work to make sure that people are connected to de-implementation spaces in other areas of public and social service. So thank you again for joining us today, for asking your important questions and raising your important examples, and take good care. Charles, anything else you want to say?
Thank you all for being here. I know there is like 4 minutes left, so I guess we are open to questions if there's any.
Yeah.
Absolutely. I just want to just echo that. Thanks. Thank you so much, Dr. Rock and Dr. Lee. This has been fantastic. Just the framing that you put there, and also something that you mentioned about things creeping back under different types of names. I'm looking at something. I think it's the Personal Responsibility and Work Opportunity Reconciliation Act of 1996, which was basically work requirements. I see you nodding, Charles. 30 years ago, right? Social recipients, Medicaid and SNAP recipients had to, certain work activity. And guess what's happening in January 2027? The same thing, 30 years later. And so it's just that's something that you have to, keep your mind. I thought it was just really relevant. And I think all of us are just blessed for your expertise and compassionate and just genuine, humble attitude that has left us much better prepared public health practitioners within the state and nationwide. Thank you.
Those words, and it's a nice reminder that history is a really important part of the conversation. History has some evidence for us and has some answers for us, doesn't it? So thank you for mentioning that.
Absolutely. Absolutely. All right. Anyone else before we close out? I see lots of thank yous in the chat. I'll close it out with that. Thank you all.